Welcome, agents and brokers. I'm Valeria Hernandez from Benavest. Today we will help you master your skills with this Oscar presentation. Let me introduce our guest speaker for today. She's Addie Evans.
Hi, thank you. Thank you, Valeria. Thank you so much. It's an honor and a privilege to be here. I must say that it was so much fun attending the event, and I'm looking forward to many more. So we're going to get started because we do have a lot of material to cover, and I will do my best to go as slow because there's a lot of screenshots and a lot of things that I want to go over with you, especially when it comes to the website and to the broker portal. So let's begin. So good afternoon, everyone. Welcome to our individual webinar. Thank you so much for taking the time this afternoon. My name is Addie Evans, and I'm the sales lead for the state of Florida. On behalf of Madeline Aratola, who is our associate director, and the rest of our team, welcome once again. Thank you for taking the time this afternoon to listen and to learn a little bit and to ask questions. So we'll definitely leave plenty of time for you to ask any questions. So I want to pause for a second here because we want to take a moment to really acknowledge you for your patience, for your commitment, and really for your support in the last few months. Thank you so much for that. We really appreciate it, and thank you again. So let me tell you a little bit about me. I have been in the insurance industry for a little bit over 20 years, here at Oscar for 3 years. And I have 3 sons, Joey, Nick, and Austin. And I am also the mom of my 2 canine daughters, Mia and Lola. And I am married. I have a bachelor's degree from Florida Atlantic University, and then my master's in business from the University of Miami. So I'm a Go Canes supporter, 100%. And have my mom, and I am married. And yeah, I'm really humble for this opportunity. So we're going to get started. We have a lot of information about Oscar. I know that we have some new agents attending, so I wanted to touch a little bit on that. And also we're going to go over the agent best practices, and then we're going to have some market highlights. We're going to touch on 3 plans for the state of Florida. I want to go over the networks in outside the state of Florida in some areas like Georgia and Texas. There have been major expansions in those states, so I want to bring that up and show you. So let's talk about Oscar for a minute. Oscar is the first health insurance company built around a technology that has provided products and services with a relentless focus on serving our members. When it comes to the ACA, we're one of the most experienced carriers in the country. Oscar is very unique. Historically and today, we have combined technology with a member-centric approach to drive more cost savings and a higher consumer satisfaction. And you'll be able to see this as we go through the presentation with the tools we have built not only for our members, but for you, our brokers as well. We have created an easy and accessible experience for all. So this is our journey. Our journey began in 2013. We finished our first OEP with 15,000 members. And throughout the years, as you can see the growth, right? This past AEP, we ended with over 1 million members alongside three segments. So thanks to you, really, it has been incredible growth for a company that's been around for 10 years. It has been an incredible accomplishment. So this is what Oscar looks for 2024. This is our individual national footprint. As you can see, we're in 19 states, 577 counties, 3 product lines, and over 2,700 employees. The agent best practices, we're going to go over this real quick, but I want to touch on this because this is definitely very important. We expect all of our brokers to follow ethical business practices and abide by the principles of honesty, transparency, and fair treatment of customers. Our broker oversight team monitors and investigates non-compliance, enforces Oscar's business rules, drives transparency with brokers, and elevates broker knowledge. We expect our brokers to complete and thoroughly document or record all interactions with members. Consent must be captured and documented. We expect that all staff at offices are trained in handling and securing personal information. And lastly, but not least, to accurately complete enrollment information. This right here is something that I want to touch on because this became available on September 1st. It's our new producer agreement. So please know that there's three key areas that have been updated. We have clarified business rules and terminology. We have streamlined document formatting, and we have updated regulatory language. A lot of the questions that I get is, where do I find this, right? So when you first log into your broker portal and you come to the page where it welcomes you, so let's say, for example, welcome Ari Evans, right? So the first column, you have your welcome, and then you like my details, that's what it's called. Then you have star selling, which is the second column, and the third column is the agency details. Under the second column, under star selling, you will see that if it doesn't have a little check mark next to the bubble that says sign producer agreement, is because you haven't signed the new producer agreement. Please do so. Just click on the arrow, go ahead and review it and sign it. Then the check mark, once it's signed, the check mark will show on this section next to the signed producer agreement. I'll leave this up for a couple of minutes here, a couple of seconds. And please let me know if there's any questions about this. We want to get into the broker portal and managing your book of business. So this is something I want to take my time going over this because this is really important. So once you want to find the Oscar broker portal, right? So you go to hioscar.com/brokers. There, the page is going to change and it's going to land where it says working with Oscar, right? So you're going to get to either get appointed, click on that, or log in. But let's just pause here for a second, because what I want to call out is things that are part of that broker out of that page, right? Before you log into the broker portal, okay? So there, let me go back to that page. Give me one second, right here. So there, you're going to find resources, right? It's a wealth of information. So if you scroll down where it's underneath where it says get appointed or login, you're going to be able to find plan documents. You're going to be able to find marketing materials. You don't have to log into the broker portal to find providers and search for prescription coverage medications, whatever the tier that they're on, okay? And you're also are going to be able to register for future events, which I encourage you to listen to the events that we're going to be doing for the different states, where we get into more details when it comes to Georgia, Texas, Iowa. You'll see there's a wealth of information there where you'll be able to register for those events. But I encourage you to take a look at this And this is all before you even get to log into the broker portal, okay? So now let's log into the broker portal. So you click on their login. Let me change the page. And here is where you're gonna have the welcome page, right? And like mentioned before, the welcome page is gonna say welcome RA Evans, for example. You're gonna have the 3 columns, my details, start selling, agency details. But on the top, you're gonna see where it reads individual book. Please click on that, okay? Once you click on the individual book, right, in there, you're going to be able to see all your book of business, right? By the way, there's a section there under menu. If you click on their menu, you're going to be able to take a look at business and commissions. If you click on their individual book of business and you click under the individual's name, you're going to be able to see print member ID cards, okay? This is really important because if you click under the person's name, let's say, for example, you have a member that has not been able or has not received their ID card, or they have lost their ID card, or maybe they don't have access to the app on their phone, right? You'll be able to go in there and print an ID card for them, right? Also, in that page, you're going to be able to engage your clients. So you have an option to be able to send emails where they'll be able to get a tutorial on how to download the app, right? Which is a great tool. Especially we have found, right, that the more people are engaged, they're easier to renew, they stay longer with us. So we totally encourage you to use that portion to be able to engage the membership. This one right here, it's also, especially now that we're getting to almost open enrollment. It's not open yet. I have not seen the renewals yet. I checked this morning. But here, eventually, you'll be able to download your book of business to review your renewals. I mean, right now you can download it, right? But you're not going to see where it's, you're not going to have the little click where you're going to be able to click to renew or see where they're being mapped to, right? Because we do have some changes for 2024, and we'll get that in a little bit. But so in this section right here, this is one of my personal favorites because you get to actually review, right? For example, you can put it in order of the policies that are active. You're going to be able to see policies that are inactive, policies that are on the grace period. So this is it, my friends. This is your book, right? So I encourage you to go in here and take a look. And if you have any more questions about it, just let me know. Also, in this section here, it's where you have an opportunity for new clients to be able to enroll them through the Oscar website. So I'll leave this up. So another thing that I want to go over here on the broker portal, and this is what I was referring to once you log in, that you get to see your welcome and your name, and then you get to see the 3 columns. When you click on the side, right, and it's going to read menu. Under menu, right, you're going to have many options. If you want to get appointed in other states, this is the opportunity for you to be appointed in other areas also. But the one that I really want to call out to your attention is where you'll be able to actually see, right, this is within your broker portal. You'll be able to search our providers, and you'll be able to also search them for the medications, right? And in here is where you can demo the member app. Okay, so I encourage you to take a look at it because it's a great tool that we have for our members. So this way you can become a little bit more familiar with the tools that we offer the membership. Another thing that I want to go over is how to make payments via PayNow, right? Which is a tool that we use to when you enroll through healthcare.gov, either Health Sherpa or our system that is Stride. Immediately upon enrolling, click on the Pay button, the Pay Now button. Select that you're a broker when asked if you're a broker or a member. Just bear with me, I need to move the screen. Click the Pay Now page with pre-filled payment information and submit the payment. If you have submitted your MPN and the subscriber email, both will receive a confirmation payment submission. Okay. Also, in our website, you can also make payments on behalf of the client. You can access your individual and family book of business in your broker portal. You select the client to view their profile, right? So in this instance right here, if we want to see Leo Perez, we click on Leo, right? And you'll be able to click billing and statements to view payment history, right? It gets into detail by subscriber. You'll be able to click Pay Now under any outstanding balances. And you have an option to email client the receipt. We've also leave this up here for a moment. By the way, in here, in this, after you click in the individual book of business, if you click on export, right, you'll be able to download your entire book. You can have it and save it on a document or save it actually on an Excel worksheet. So make sure that you do have Excel access, so then it'll be saved into that. And then the last thing I want to remind you is I don't have the information. I do see that there's a form of payments. What form of payments will Oscar accept in 2024? I don't have that information as of yet, okay? I will save this, and as soon as I get that, I will email Regina so she can pass the information to all of you, okay? Going back to the demo member app, okay? When you click on menu, you should be able to see it under your name, and you should be able to click on that. Also, in this section here is where we like for you, if you have an opportunity to engage your clients, and you can send the different tutorials and guides for them to be able to download the app. So let's talk a little bit about 2024, what's new, and the market highlights. So I'm not sure if you know, but I just want to let you know that there has been some updates that CMS is requiring all carriers for 2024 and streamlining of plans, right? So at Oscar, we have, we're abiding by the CMS guidelines and the CMS mandates, and we have prioritized plans that maintain low deductibles, low copays, and low PCP costs. There's a couple of plans that I want to call to your attention because those plans are going to be discontinued, and I want you to be aware of that now. One are the HSA compatible plans. Those are plans where just really wasn't that much membership in those plans. And the other plan that we're not going to be offering in South Florida is going to be the diabetes plan, okay? So what's going to happen is that there's going to be, per metallic level, there's going to be one standard plan and 4 additional non-standard plans, okay? And we'll get into what that is. Another thing that I want to call to your attention is that we're expanding our footprint in Florida, where we're adding Polk County as one of the counties. We're keeping the same counties that we are currently in, right? But we're adding Polk County, so we're expanding our footprint. And outside Florida, in other states, we're adding 120 other counties. So we'll get into those slides in a second. I want you to see the growth and the expansion in other areas, okay? And then another thing that I want to call to your attention is that we have updated the urgent care copays to be better aligned with our specialist copays. And one thing that is really important and I want to call out is that we're going to have 2 formularies, right? So the plans that are standard plans, right? The formulary has been expanded from 2 tiers to 4 tiers. The non-standard plans, those is the formulary, the existing formulary that we currently have. And those are the ones that offer the tier 1A at $3, right? And by the way, like most of the medications that we have found, right? Probably 80% of the medication needs are on tier 1A, okay? So those are still there, tier 1A at $3 in the non-standard plans. And we'll get into those in a second, but I wanted you to know that we're still keeping that. Another thing that I want to call out is our video and phone appointment. So those are still for clients that can schedule their video and a phone appointment with Oscar Primary Care. Those are still $0 copays in Miami, Broward, and Palm Beach. And then obviously the virtual urgent care that is unlimited, available 24/7. I know it says here for all plans except the HSA and catastrophic. We will not have the HSA plans from 2024. And this is just a reminder, we just went over this, that Oscar will offer 2 formularies this coming year. The formulary for the standard plans, that it's going from 2 tiers to 4 tiers, and we'll continue to offer our existing formulary for our non-standard plans. And just another reminder about our non-standard plans are going to continue to offer the tier 1A drugs. Here is what it looks, our footprint in Florida for 2024 with the addition, which we're really super excited about, which is Polk County. A couple of things that I want to call to your attention. We feel that we're going to be very competitive when it comes to Broward and Palm Beach, obviously will stay in the game. And when it comes to Miami-Dade, other counties that we feel we're going to be competitive at, it's going to be Orange and Hillsborough. So we'll get into the outside Florida for those that are interested in getting appointed in other states. We'll get into those in a second. Leave this up. I encourage you to, if you want to take a picture so you can, I love this map. Just as a reminder that all of our Oscar plans are EPO. We have the same network for all plans. So you don't have to worry about that, right? You don't have to worry that sometimes, you know, in other carriers, depending on the plan, you have to worry about the network. All Oscar plans have the same network, okay? And all members have access to the full statewide network with no referrals to see a specialist. So this is a big deal, okay? And in addition, we have thousands of physicians in the network. And our partnership continues with the major health systems throughout the state of Florida, okay? And by the way, some of the questions that I get sometimes is, so if I live in Miami-Dade, can I go to a hospital in Broward County? The answer is yes, or vice versa. So let me go back to this for a second. So what I want to tell you is that because the next 3 slides, we're going to feature 3 plans, which that's where the most of the membership is, and also is probably the plans that we feel are going to be the best sellers this coming season as well, okay? So I want to give the spotlight to this plan right here, which is the Bronze Elite Saver Plus, okay? And let me tell you why we love this plan. Obviously, you have urgent care copay, and it does have an affordable specialist copay, okay? Now, this plan is for customers who want the affordability of a bronze plan with a good specialist copay. And for a bronze, really, is for customers who like a copay structure, okay? Now, one thing I do want to call out when it comes to this plan is that if you have someone that it's on a tier 2 or above, it's deductible driven first, right? When it comes to that. So please be conscious of that. Of this plan, if you have someone that is on a tier 2 or higher, right? Because it is not designed for those customers. Also, I want you to take a look at the labs, right? So Quest and LabCorp are our preferred labs, right? Those are $25. It's tier 1. All other labs will be $50, a higher copay. So please know that. You'll notice that in our plans for labs, you have the tier 1 and then you have tier 2, right? Tier 1 will always be Quest and LabCorp. The second plan that I want to highlight is the Silver Simple PCP Saver. And we have taken the liberty to show you what the plan would look like with the CSR 150, CSR 200, and 250, okay? We believe this plan is best for CSR 150 and 200 consumers who are looking for benefit-rich plan at the most affordable price point. This plan has a rich pharmacy benefit to help members save on their medication. And it also offers copays for PCP specialists, urgent care, x-rays, and advanced imaging. Okay, and as you can see, this is a non-standard plan. So you do have the tier 1A and tier 1B RX, and you don't have to, in the CSR 150, it's a zero copay for tier 1A. Okay, so a lot of the membership is in this plan. Okay, I want to just highlight it due to the fact and for our new agents to be aware. Also, it's an EPO, okay? It provides members the ability to choose any PCP they wish and no referrals to see the specialist. Please remember that tiers 1 and tier 2 for lab, okay? And LabCorp and Quest are always a tier 1. So I'll leave this up. This is a great comparison here with the different levels and percentages. So the third plan that I want to call to your attention coming up is the Silver Elite. Also here, we've taken the liberty to show you what the plan would look like at CSR 150 and 200 and the 250 percentages. This is for consumers within the 100 and 150 of PNL and other consumers receiving subsidies. It has 0 primary care offices, low ER copays, low deductibles, and low MOOP. And always remember that our plans are non-gated EPO plans with no referrals to see the specialist. Okay. This plan is looks good because of the copay. It's a copay heavy, right? And at an affordable price. So take a look at the MOOP here. Okay, with the different levels. Urgent care also. Okay. So those are the 3 main plans that we want to highlight for you. I also want to tell you a little bit about Georgia. So in Georgia, we have 3 major health systems. We have Northside Hospital, we have Emory Healthcare, and we have WellStar. We're expanding to 18 counties in Georgia. Just want to call out that we are probably going to be the cost leader in Metro Atlanta. So we're excited about that. And obviously, we're excited about the expansion into the 18 new counties. Another area that we are seeing a lot of growth is in Texas. We are expanding to 26 counties, and we have the different health systems in the state of Texas: Memorial Hermann, HCA, St. David's Healthcare, Ascension, Medical City, Dallas, and Methodist Health Systems. I'll leave this up for a few seconds. Goodness, in Iowa, 50 new counties with the 2 major health systems, Mercy One and Genesis. And Missouri, 7 new counties. So I want to give just a shout out to our broker support team. They're incredible, and they're always here to help us. So they're here for you. Oops, sorry about that. So there's two, actually just want to call out the phone number. It's 855-672-2713. And for basic questions regarding, you can please email the brokers at highoscar.com. Monday through Friday, they're open from 8 a.m. to 8 p.m. Eastern Standard Time. And here's my email address. I'm Ari, again, Ari Evans. And my email is ari@highoscar.com. And I know that we went over a little bit. I always try to keep the meetings, the presentations under 30 minutes, but I'll stay for as long as you need me to. If you have any questions for me, I'm going to bring back the question regarding the different health systems for the state of Florida, that slide, and the expansion map, because those are always good questions. So let me go back to that, and then we'll touch on the 3 plans one more time. Oops, sorry. Okay, so here is a picture of the service area for the state of Florida with the new addition of Polk County. And then so let's see, what is the question? So we do encourage everyone to assign a physician at the time of enrollment, okay? I believe what you see here are the values on the plans are up to date. Yes. Let me go back to the other one. Here is the state of Florida statewide network with the major health systems, right? Just as a reminder that it is an EPO plan. You do not need a referral to see a specialist, and you can use any in-network providers within the state. If you have any more questions. Oops, erase this out. So actually, I believe that those slides should be already on the website. If not, I will try to get them for you. Danny, I see your question here. So definitely I will try to get them on PDF if they're not already on the website. A lot of the information that I've provided here, by the way, it's already up on the Oscar, on highoscar.com. So let's just want to tell you the names of the 3 plans that we believe are going to be the best sellers in Florida. One of them is the Bronze Elite Saver. The second one is the Silver Simple PCP Saver and the Silver Elite. Let me just see if we have any other questions. How do you know which plans are standard and non-standard? Great question. If they have the word standard right next to it, it's obviously that would be a standard plan, right? They would have standard as part of their name convention. Yes, correct. Where it says advanced imaging, is that the copay for MRI CT scans? Correct. Thank you, everyone. Let me see. Yeah, answer that question. Correct. My friends, I'll leave you my email address. Let's go back to the last page. Also, I want to encourage you to attend our webinars for the other states. You will find those in our portal, right? State-specific webinars. We've been hosting those. I did the one in Spanish for the state of Georgia last week. I did, and there's some more coming. I mean, we're doing them all through the month of October up to, I believe even the last one, it might be even be on the 30th, I believe, of October. So I encourage you to listen, become familiar with the state of Georgia, the state of Texas, all the other states. So especially those that are interested in learning a little bit more and want to be appointed in those states. I'm Addie Evans. Thank you so much. It's been a pleasure. I just want to make sure before I go that there's no other questions. I think we've touched on everything. It's been an honor and a privilege. Thank you, everyone. I look forward to working with you. Any questions, do not hesitate to reach out to me. I'm here to help you grow your business, to answer any questions, and to really help you grow. Thanks again. It's been an honor and a privilege. Be well.
Thank you, Addie, so much for this presentation.
Thank you. Thank you so much. Have a great one.
Remember that you can view this webinar again in the All Access Agent portal, logging in through Insureuniversity.com. If you want to get contracted or you want to contact us in the future, our support information is here. Please write it down or take a screenshot. Again, thank you so much for joining today's webinar. We're looking forward to see you again on future webinars.
Thank you.
Thank you.